In fact, we'll wait just a few more minutes for more attendees to join us. We already have over 50 people on the line. Other people are joining. So let's wait 3 or 4 minutes and then we'll get started. Thank you for your patience. All right, let's go ahead and get started. Again, my name is Paul Salem, President of the Middle East Institute in Washington, D.C., joined by a number of wonderful colleagues from around the world. Today's session focuses on the COVID-19 crisis in the Black Sea area, potential threats and regional policy responses. Obviously, the Black Sea states, like all countries around the world, have been hit hard by this crisis. We're going to look at the health and public health implications, look obviously at how it's impacted the economies, how it's impacted sort of the political and civil society situation, but also to explore the regional and international aspects of it. This virtual panel is the first of a series of webinars hosted by a new initiative at the Middle East Institute called Frontier Europe. This new program explores the interactions between the Middle East countries and their closest European neighbors. That means some parts of Eastern Europe, Central Asia, and the Caucasus, which kind of form a frontier between Western Europe, Russia, and the Middle East. So we look forward to many, many more such events and hope to have you as an audience with us. For more information on this program, just take a look at our website, which is mei.edu, or look at our Twitter feed for this program, which is at MEI Frontier. Today we're going to hear from a great group of experts joining us, as I said, from various countries. Let me quickly introduce them before we start the discussion. We have joining us from Kiev, Ukraine, Dr. Ulana Suprun. Ulana, thank you for joining us. She was the acting Minister of Health of Ukraine from 2016 to 2019. She's the former Director of Humanitarian Initiatives for the Ukrainian World Congress and currently heads the NGO ARC.UA. So Ulana, thanks for being with us. We're happy to have Mariam Krivishvili. Mariam is the head of the Georgian National Tourism Administration, and she's been with that administration for a long time. We're very happy to have her, particularly to help us understand what's going on in Georgia, in her sector and other sectors. Joining us from Boston, US, is Dr. Imra Altindish. Imra is an assistant professor at the Boston College Biology Department, so a scientist on this panel, and an adjunct faculty member of the Joslin Diabetes Center. He is from Turkey and will be helping us understand what's going on in Turkey. And we are joined by our own Yulia Sabina Joja. Yulia is a senior fellow at MEI, the Middle East Institute Frontier Europe Initiative. She's a postdoctoral fellow at the Johns Hopkins School of Advanced International Studies next door in DC, and an adjunct professor at Georgetown University. She will be focusing primarily on Romania and Bulgaria. We're joined by you, our audience. Currently, there are 75 people that have joined so far. We look to your questions and to responding to your questions. If you're on Zoom, use the Q&A feature, which is on your screen. I think you'll find it at the top of your screen. Just submit your questions there. I will try to throw in as many of those questions as I can. I've already gotten a couple of excellent questions that I will weave into the conversation. If you're not joining by Zoom and have called in, you can ask a question on Twitter. Use the hashtag MEI Frontier Europe. Pose your question. Our team will be monitoring that, or send an email to events@mei.edu. If you have any technical problems, please use Zoom's chat function, or again, use the email events@mei.edu. With that, let's begin. This session will be about an hour long, so we'll try to keep it quick. I will start with 3 quick rounds of questions. The first round will really be to focus on the health situation, the pandemic itself, the public health response. The second round will be on the governance, politics, civil society, sort of how the country is dealing with it. And the third round will be on the international or regional or external aspects of how each country is experiencing it within the Black Sea region. So, Dr. Supran, let me start with you. A quick look at how the COVID-19 has hit Ukraine. What are the numbers? What are the prognoses?
Thank you very much. Thanks for inviting me. And as of today, there are 804 confirmed cases of infection with coronavirus, and there have been 20 deaths in Ukraine. Ukraine has come late in the game. Our first case was only in the beginning of March. And because we didn't have test kits and we didn't have the ability to test patients, we really didn't have a good handle on what was happening most of the month of March. Only in the last week has there been enough test kits available that we started doing a little bit wider testing, but we've been testing only those that are symptomatic, that already have pneumonia, or that have the symptoms of coronavirus, which is the high fever, the fatigue, headache, and dry cough that have returned from other countries. So in Ukraine, we had a distribution of mostly currently young people between the ages of 21 to 50 years old that are the ones that are infected. That's common in the beginning. Those are the ones that returned from outside of the country, and the family members of those who returned outside of the country. However, of the 20 deaths, the vast majority of them are over the age of 65, and they have comorbidities very similar to the way that it is in other countries. One of the issues that we have here in Ukraine is that we are just currently going through a reform of our healthcare system. Our primary care system is working very well, and that's good because that is the front line. Those are the foot soldiers of the current epidemic, and they're the ones that people will call into first to find out what they should do if they have symptoms, what are the next steps. So our primary care system is already working quite well, but only yesterday on April 1st was the next step in our healthcare reform, where the hospitals are now getting a different form of financing, where instead of having a global budget, they'll be receiving payment for services provided for them. We have a very old infrastructure that hasn't been renewed, and we have only about 6,000 available ventilators. That's including the ones that are in operating rooms for a population of 37 million. So we are quite behind the ball on all of this, and much of it has to do with a very late response. We've had a change of three different healthcare ministers in the last month, and because of that, there hasn't been very strong leadership. However, is the
country on sort of shutdown, lockdown, like many other countries? What are the numbers that you or others might expect in the coming 2 to 3 weeks or the next couple of months?
Over the last 2 weeks, there have been increasing rules for lockdown. Currently, just yesterday, the Cabinet of Ministers passed an order where no more than 2 people can be walking together outside. Everyone should be wearing masks in public places. Those people should be staying home that are not involved in the response at this current time. And there's very severe shutdown at this point. However, over the last 2 weeks, it was slowly increasing over time. One of the problems that we have is that we had about 500,000 people return from outside of Ukraine back into Ukraine over the last month. And most of them returned back without doing any self-isolation or doing any particular measures to stop them from infecting those around them. And we may very well have many more cases than we know of because we haven't been testing. We anticipate that in the next 3 weeks, we're going to see a very big upswing in the number of cases because we're able to test. And it started with Kyiv City and Chernivtsi Oblast, where the first outbreaks were. And now there are 5 oblasts that have pretty significant outbreaks. And almost every oblast except for one, which is localized centrally within Ukraine, all of the other oblasts already have at a minimum 1 to 5 cases. But the worst are in Kyiv City and in the Chernivtsi Oblast, which is right on the border with Moldova.
Thank you so much, Ulana. Mariam, let me turn to you. What's the situation in Georgia on the numbers and the expectations on the health side for now?
Good morning. Good morning, everyone. First of all, thank you very much for bringing Georgia in the picture. It is my great honor to elaborate that government of Georgia has starting to make efficient and most importantly timely actions to prevent the spread of coronavirus in Georgia, which makes me very proud to say that today, starting from 26th of February 2020, we only have 130 cases, confirmed cases of COVID-19, with very positive outcome of already 26 patients already out of hospital, fully recovered. We also have a positive note to share to the rest of the world that as of today, we don't have even a single case of the fatal ending of the coronavirus story in our country. Well, Georgian government has been and has started to work very closely with World Health Organization, even back in the days when virus was spreading throughout the country, but it was not even brought into the country back in the days, which has resulted into bringing in a lot of changes throughout our daily routine. The virus spread has been a concern for so many other countries, but what we as a nation have done on a timely manner was to start with suspending direct flights from into all those countries that were named as hot spots by World Health Organization. Profiling of all the passengers were started immediately in all international airports. People were quarantined, and it has been more than 2 weeks since everyone who is crossing Georgian border has to go through a mandatory 14-day quarantine. And of course, Georgian government has already ensured that there are enough quarantine spaces throughout the country. Currently, we have more than 5,500 people in mandatory quarantines. And I think it's also important that as a country which has been already very active in tourism, we ensure that their stay in quarantine spaces are extremely comfortable. Well, furthermore, Georgia declared a state of emergency, imposing various restrictions and strict regulations on mass gatherings, public transport, intercity traffic, shopping facilities, etc. And I think it's very important to highlight that even World Health Organization gave a very positive assessment to Georgia's efforts for preventing spread of coronavirus outbreak into our country.
Fantastic. That's some good news from the region. Thank you, Mariam. Emrah, let me turn to you. And Turkey, obviously, a very large country, has a lot of refugees, a lot of borders Iran as well. Give us a picture of how things have evolved in Turkey and what the pandemic looks like in the coming weeks.
Yeah. Can I share my screen, please, so I can give you a picture of this? So,
Yes, we'll have our technical
okay.
people on
So,
it.
yeah, meanwhile, I can also start. So, as of last night, April 1st, in Turkey, we have 15,679 cases and confirmed cases, and the deaths are 277. The first case was seen in March 11th, and the first death was seen in March 17th. So it means that, so I think you can see my screen right now.
Yes, now we
All
can.
right. Okay. So let's start with the world. So because I'm a scientist, I like numbers. So as of today, we are very close to 1 million cases in the world. And as you see in the Black Sea region, we have many cases, but the new center of the pandemic is US. It was Italy before, and it started from China, and we will reach to 50,000 deaths as of today. So this virus is so strong because of two reasons. First, the mortality rates of this virus is 10 times more than the influenza virus. This is the first thing. But the second strength is here. 30% of the people who will be infected with this virus will not show any symptoms. And 55% have very mild symptoms. So these people will carry the virus to the people who has the risk factors like age over 60 or with the chronic diseases. So what we have been trying to do is here, this is a very brief, simple figure showing the transmission of the virus from an infected person to break this chain. So how are things going in Turkey? So here you see, this is the data from the April 1st, and you can see in a comparable scale. Here you see the number of the confirmed case after the 1,000th case, and here are the days on the x-axis. And as you see, Turkey has a very steep curve. So it is in between US and Spain. So these are the two countries that the cases are increasing very rapidly, and Turkey is just there. So this is very alarming. This means that in the next 2 to 4 weeks, we have a very large surge as we have been seeing in the US. And this increase is more rapid and more steep than both Italy, as you see right here, and Spain. So this is alarming. In this figure, you will see two countries that were able to flatten the curve. Flatten the curve means that to be able to control the number of the cases. The first one is China. They did a great job in Wuhan to be able to contain this disease, and they did it by one method, which is locking down a huge state. In the South Korean case, they used mass testing. They tested 20,000 people per day, and they're testing even more. So these are the two models that works. In case of Turkey, we didn't lock down any city yet, unfortunately, and we just started to do some good testing. So here are the numbers again. As of April 1st, the confirmed cases are over 15,000. So the first case was in March 11th. This means that in 20 days, we had confirmed more than 15,000 people. And the first death was on March 17th right here. And just in 2 weeks, a bit more than 2 weeks, we lost 277 people. We have approximately 1,000 people now in the intensive care units. And the mortality rate is 1.77. This is approximately 10% in Italy, and in Spain also it is very high. In our case, it is much less. It might be because they didn't detect some of the viral infection in some dead people, or because we have a very young population, unlike Italy and Spain. So there are several problems about transparency and in the process, but I can talk about this later maybe. But what I would say is that if you are listening to someone who is talking for a government, I think you have to be very skeptical in this disease and during this contagion. So this is a very contagious disease. We will see the effects in the next 4-8 weeks. So I don't think that any country except South Korea and Japan is doing a great job right now. And I think we have to be very skeptical also when we are looking at ourselves. So the things are going alarming in Turkey because this increase is extremely steep and then the cases are increasing very rapidly.
Well, you mentioned that the government is beginning testing, or the system is beginning to test. There is no full lockdown. But what is the government saying in terms of, is it using masks, social distancing?
Okay,
Are
yeah.
they planning a lockdown? How are they going to deal with it?
So the working class people are going to work every day. And the Turkish health minister, president, and everyone is asking people to stay at home. But people cannot stay at home and they have to go to work. So this is a problem. So they did the things that our colleague in Georgia said. They suspended the flights from some of the countries. They banned people over 65 years old to go out, and they cannot go out. So they are trying to protect them, but their sons, daughters, or grandsons, granddaughters are going to work and bringing the virus back to home. Unfortunately, of course, they canceled any kind of mass gatherings. They closed the restaurants and they suggest people social distancing every day. But without locking down the cities, it is impossible. So let's look at here. Here, we didn't have this information until last night. So we didn't know which cities were infected. Here you see the name of the cities that are mostly infected, the most 10 cities. And Istanbul has 8,852 cases, which means that the infection is really concentrated in Istanbul. And Istanbul is a 16 million people city. It is an extremely populated, dense city like New York, even more than New York. So this is alarming. And we have been asking government to have lockdowns especially in this city, in Istanbul, because many scientists are very concerned that this might become a new New York. So it is very interesting that in 24th of February, the Turkish health minister gave an interview to one of the famous journalists, and he said that Wuhan and China and Italy are doing the right thing by quarantining their cities and their country, and Iran made a mistake by not quarantining Qum, the first city that they saw the infection. So he gave this interview 5 weeks ago. But in the last 5 weeks, we have no single city that is quarantined. We know that the scientific council, so we have a scientific council now advises to the government, asks for a quarantine, and they are just denying it. The health minister is aware of the fact that this is the only way to control the viral infection in Istanbul and in Turkey, but we don't know the reasons. We can just speculate, but he cannot just start this quarantine in Istanbul, and the mayor of Istanbul is crying now. He asks for a lockdown.
Thank you, Emrah. Very disturbing and concerning. Yulia, let me turn to you and give us a view maybe of Romania and Bulgaria and how they are faring.
Sure. Thank you for organizing and for having us here. It's a great opportunity, and I'm looking forward to our discussion and to the questions that we get from the region as well. When it comes to Romania and Bulgaria, the situation is not really comparable. Even though it's two small countries, Romania has had the outstart far earlier, the first detected case compared to Bulgaria. It was the first one in the region on the 25th of March. And so the increase in terms of cases, though the approach in terms of government has been comparable, the increase is in cases is far higher in Romania than in Bulgaria. At the moment, we have about 2,700, almost 2,800 cases in Romania and less than 500 cases in Bulgaria. With similar concerns in terms of the effect in the next few weeks. Both countries have been reacting similarly in terms of imposing a lockdown. Bulgaria was the first one who had actually the military forces on the street. Romania followed shortly. The orders are shelter in place with very strict restrictions, and to be able to understand why these restrictions are so and were taken so early on, it's because both governments have reacted to the fact that people were not well informed enough and were not taking precautions enough. And so in Romania, for instance, similar to Ukraine, we've had over the last month 250,000 people returning who are working abroad. In Bulgaria, it's a similar case, but far smaller numbers. Out of the 250,000 that have returned in the month of March, 50,000 are from Italy. And many of them, Romania, of course, is taking all its citizens back, like everyone else in the region, but self-quarantining has not been respected. And even though people have been quarantined, imposed quarantines by the government, they have not respected it. So we have one situation in northern Romania, which is already compared in media to the Romanian Lombardy region, one city where infection rates are very, very high because people have not been respecting it. So the government in both Bulgaria and in Romania has imposed very harsh measures that have been efficient so far. If we are looking at the numbers, the rise is slowly decreasing. So we're having so far initially good news. The governments have responded also pretty well in that in the region, even though Romania and Bulgaria are members of the EU, they have not had and still lack equipment, medical equipment. So Romania, for instance, was able to buy 2 million tests from South Korea, which has made a huge difference. Leadership has been difficult as well. We had in Romania the health minister resigning. In Bulgaria, the prime minister accusing the EU of not doing enough and not helping, and we can discuss that a little bit later on in terms of EU response. But in terms of numbers and health issues, there's problems with equipment and with the protection of the medical staff. In Romania, for instance, in Bulgaria, sorry, medical staff have resigned because of the lack of equipment, and in Romania they have threatened to do so. And we have a particularly complicated situation in Romania because we are approximating right now that about 25% of the medical staff could be infected at this moment, particularly in that northern region. But medical staff, hospital staff have not been taking the necessary precautions, partially because they lacked equipment. So this is potentially creating one big crisis if medical staff is infected. The government in Romania has already imposed measures that if medical staff is infected and is feeling well, they can continue to treat other infected patients. That's pretty harsh, and but it shows how grave the situation is. And the prediction for the next few weeks is serious in both cases as well, Romania and Bulgaria, as well as Moldova, Ukraine, and many countries in the region, that there's still massively people returning, partially because from Western Europe that could be potentially infected, partially because of the lockdowns in Western Europe as well as in our region in the Black Sea, and partially also because Easter approaches and people want to spend time with the family. So we've had heads of government and of states in the region reacting very differently. Some of them have been saying, please return as fast as you can. Others have been saying, you should try to stay home because it's safer in that way and you're not infecting your immediate family. So the predictions right now of experts in terms of health and public government are that they've kept in the region, in Romania and Bulgaria, the numbers low so far, and they've been coping well with the crisis, but that we should expect a surge in the next month because of massive returns.
Well, thank you, Julia. Let me do a second round of questions, and I'm also integrating some questions from our audience. So thank you for the audience for sending the questions. Let me again go back to you, Ulana. And I'm asking in two categories. One is politics and economics of this. But before getting into that, maybe if you could tell us a bit about particularly vulnerable communities in conflict zones, parts of Ukraine, which have other problems. How do you see that? So a bit about that, but then what is the politics of this in Ukraine? And given that this crisis is likely to go on for many months, the economic impact is already huge. It's going to be bigger than the 2008 crisis, maybe comparable to the impact of the world wars or the Great Depression of the 1930s. The US is putting trillions of dollars in the economy to keep it afloat. How are the governments thinking about the long-term impacts as well? So let me start with you, Lana.
Well, first of all, we're not getting any information from the occupied territories of Crimea and parts of the Donbas region. Those areas, we don't know how many infected are there. There are cross points between the occupied and unoccupied territories, those under Ukrainian government control, and those were closed about a week ago so that there wasn't any crossing of those points, so that there wouldn't be infection coming from one side to the other. There is a lack of medical services along that contact line. Of course, that's something that is a fact in most countries. I'm sure it's similar in Syria that's happening right now. There's a lack of medical personnel, there's a lack of medical services, and it's very difficult to know what's going on in those areas. But because it's sparsely populated and there aren't people that have traveled recently in those areas, it may be that they might be better protected in the sense that there isn't an infectious process happening. The biggest worry is the military. Because there's a war going on in Ukraine, our military is deployed on our own land, and the military lives in those kinds of conditions where it could very easily pass the virus from one person to another. So there's been quite an effort by both the Ministry of Defense as well as organizations, civil society that help the military so that they can have the test kits and also any protective equipment that's necessary for their physicians. So far, there haven't been any reports of any serious outbreaks in those areas. And of course, many of them haven't been traveling outside of the country. What's happened is they've cut off all furloughs. So the military that are now deployed in the war zone will be remaining in the war zone until after the quarantine. There will not be an exchange of personnel. That will hopefully keep them safe. That's the first part of it. The second part is the politics and economy. As I said, we had a changeover. We actually had a changeover our entire cabinet of ministers in the beginning of March. And now we already have a third, so there was a change. There was one minister of health in February, another one in the beginning of March, and now there's a third one. So that lack of stable leadership has really been a problem because it's no clear direction, no clear communication, and it hasn't been coordinated very well between the presidential office, the cabinet of ministers, the Ministry of Health, and so on. That's made for people to be afraid. And when the war that's happening in Ukraine is not only a physical war of armies, it's also an informational war. And when there's a lack of information, it's easy for disinformation and manipulation to come in and start scaring people more so than they really need to be worried about certain things. So there's been a lot of disinformation, a lot of stories coming in from Russia into Ukraine that have confused people and made them unsure about what's happening, and it further undermines trust in the government. That's something that's just a fact. What's happening with our economy is there are a couple of laws that need to be passed by Parliament so that we can release the next tranche from the IMF. And we desperately need that tranche currently. One of those laws was land reform. And we were lucky enough that our Parliament did pass that law in the beginning of this week. However, the second law is a banking law, and it was only passed in the first reading. There still is a second reading that has to happen. That's the anti-Kolomoisky law. There's a big battle politically going on right now whether that law will be passed. That IMF money will not be released until both these laws are signed by the president and we have a new budget. Because all of us, all countries are now making changes to their budget because of what's happening with COVID-19, with the epidemic. The IMF is not going to release the funds until they see what changes there are in the new budget. So we have a couple more steps that the Parliament has to make. And the Parliament has now gone out of session because of the epidemic. So we're balancing the safety of our parliamentarians with what needs to be done so that we can shore up our economy. Ukraine doesn't have a very robust economy. So already we're having businesses closing down because we're in a pretty much a shutdown. People are partially working from home. There's very few people that are actually going to work. And a lot of the service industry has shut down. Unfortunately, they won't be able to come back, and Ukraine doesn't have the financing to be able to shore up that business. So we're really now looking at what is our way out. And I think that's something all of our countries have to start looking at. Germany has an interesting idea of testing those that have already been through the illness or healthy adults to see if they have immunity or not. And if they do have immunity, releasing them into going back into normal societal functioning. In Ukraine, we're still at the very beginning of our peak, as I think Turkey is. There is a couple things I wanted to point out is we were talking about China and how they were successful in what they did in containing the outbreak. Unfortunately, they were unsuccessful in containing it. And that's why the rest of us in the world have been infected, because in China, instead of admitting the fact that there was an outbreak happening in one of their cities, in one of their provinces, they hid that information, not only from themselves, but also from the world. And I don't know if you remember, but in the beginning, the WHO in mid-January was told by the Chinese that there is no human-to-human transition, when they knew very well that there was. They were allowing people to leave Wuhan province rather than containing this. And many of us know the way that the reaction happens with an Ebola outbreak, how you really need to contain it into a localized geographic area. China did not do that, would not let the CDC and would not let the WHO in to take a look at what's going on. And frankly, I do not believe any of the numbers that they are putting out there, because there are many reports about hundreds and thousands of urns of after having cremations being given to families in the same city where China is reporting there were only 200 deaths. And those are the kinds of things that we can't depend on the statistics from authoritarian regimes. The statistics we're seeing now from countries like South Korea or the United States or Turkey or others that are reporting the truth are really the ones that we should depend on. And if we had seen this in the beginning, I think we would have reacted differently.
Thank you, Lana. Thank you very much. Mariam, let me go to you. A number of people in the audience have asked questions, particularly about Georgia. A person said, you know, they were living in Georgia. Sadly, they traveled to Spain just before the crisis. Things are so much worse in Spain than they are in Georgia. The questioner is asking, are you afraid that things might escalate in Georgia and you might get a situation like you do in Spain? If so, what's the plan? Do you see this as kind of a make or break crisis for the Georgian government? What is the politics of it? Another audience member asks, are you sharing your experience and your early success with some of your South Caucasus neighbors, Armenia, Azerbaijan, and others? Any cooperation there? And as I, asked Ulana in the beginning, if you could tell us a bit in the conflict areas or particularly vulnerable communities, do you have any information there? You are in the tourism sector, obviously that is affected, but what are you and the government thinking if this type of shutdown and crisis goes on for a year? Is the government pumping money? Are they turning to the EU? What's the plan economically?
First of all, thanks to everyone for interesting questions. First of all, let me start elaborating that, of course, like every other country, we're extremely cautious and we look farther ahead and not being only happy with the existing figures that stand out on the whole Georgian market. Of course, we are very mobilized. There is a very clear strategy how to minimize the spread of coronavirus. Of course, we are very clear and we know that numbers will be growing. However, the actions that Georgian government has made in early stages has really helped the nation to preserve numbers as small as they are. So that's our strategy. Our strategy is, regardless of the fact that, of course, figures will grow, we need to keep them as small as possible. So some of the examples that I've brought, what has been done, we've shut down all international airports. We've started with direct flight shutdowns to hot cities, but again, within a week from that decision, we've seen that there were people coming from so many other countries who could hypothetically have been spreading viruses. So number one decision was to really minimize and shut down all international flights. Second was decision was made to ensure that everyone who would cross the border had to go through 14 mandatory quarantine. And I've been listening to the colleagues before me who were bringing in very important insights, how communities and people were violating self-quarantine protocols. So that's why Georgian government has earlier made a decision not to really rely on homestay policies, because we've also seen a couple of examples and we really could not afford to risk other people's lives and health. So that's why what government of Georgia has done is that we've arranged places. We've rented out hotels, and we've ensured that there are rooms for everyone who has to go through mandatory 14-day quarantine. Places are extremely secure. We have health ministry representatives in-house. We have our team in-house. We have national security guys standing and securing the outside territory to ensure that there is no one leaving their room, and then of course there is no one leaving the building. So with that, we're of course ensuring the health of those who are within the quarantine, those who are living in the next doors, and of course those within the neighboring areas of the quarantine zones. Currently we have rented up to 82 hotels throughout the country. We're talking about 5,500 people currently in the quarantine. We've ensured that up to 1,500 people already went through mandatory 14-day quarantine, are back home fully healthy, back to their homes. Our strategy is extremely transparent. There is a task force gathered directly by Prime Minister of Georgia, Minister's Cabinet, fully on daily basis. Population is getting extremely clear message on what's our next day-to-day strategy. That's why every day there are decisions brought in. As I've been listening also to our colleagues, the decisions that country has made is to go on total lockdown. We have a national quarantine. It's been already here for last 3 days, which means that there are a lot of restrictions, starting from maximum 3 people gathering. No one's allowed to go out from their home from 9 p.m. till early morning, 6 a.m. So that is really helping the country. Of course, we always have to be extremely cautious to ensure that there is no domestic transmission of the virus. I think that's extremely important, because we are fully in charge of the imported cases, whoever comes in, and we are seeing at one point, it's a very positive note to see that so many Georgians who have been living abroad for so many years now see the credibility of government of Georgia, how people are well taken care of. So which means that we also need to ensure that whoever come back could be in safe hands, and then we also can preserve the safety of others who have been living into our country. We have as government, of course, I would agree with everyone who have been speaking so clearly about disinformation. It is an extremely it's extremely important, so that communities have very clear message on what to be, what's important and what needs to be really paid attention to. Because in the fight of COVID-19, I think we've all agreed here that it's a mutual responsibility. Government should have a very clear message and very clear strategy on how and what has to be done to prevent, but also population really needs to take their part of responsibility and to really go on the social distance strategy.
What is the economic plan? I mean, for 2020, this is going to go on for a long time. How is the government planning for that?
Well, for starters, I think you had a question about tourism industry, so I would start as as head of National Tourism Administration. Georgia has been an extremely active destination worldwide within the tourism sector. Of course, tourism tends to be vulnerable within the times of COVID-19. Most of you might have read that World Travel Organization estimates that 2020 would be we would reach to minimum of decline of 1 to 3%, down to an estimated growth of 3 to 4% forecast, which would equal to 30 to 50 billion in spending by international visitors, which is a very big figure. Well, the support for tourism must be, of course, a priority in all the crisis response recovery plans, and Georgia is not an exception. Georgian government has prepared and has already published an economic stimulus package to confront the negative impact of COVID-19 on economy. The measures include infrastructure spending and tax exempts to benefits of Georgia's recently booming tourism industry. There is a separate project to support economy in general with 2 billion lari package. When it comes to tourism sector support, our key aim is to preserve those who have jobs or were self-employed. So government of Georgia made a decision to support all the companies within the tourism sector and help them on tax relief format of the work, which means that the companies will have a flexibility on postponing their property and income tax. So this would help up to more than 50 people in employment and more than 18,000 companies on Georgian market. And this will help our nation to accumulate up to 100 million Georgian lari, which is up to 33 million USD in private sector. Other than that, Ministry of Economy, which is our mother ministry, is also responsible for SME development agency Enterprise Georgia, which also recently launched a financial support mechanism which encompasses co-financing of bank loan interest rates for all the guest houses, small and medium-sized hotels, which are up to 50 rooms within upcoming 6 months period of time. So and on top of it, you've also mentioned the vulnerable, comparatively vulnerable part of our community, and Prime Minister himself yesterday came into the picture and declared that government will be fully covering the charges of all the utility costs for those who are in need, and this is covering up to 1,200,000 people living on Georgian territory. And again, back to your question, government so far has mobilized more than 2 billion to ensure that there is a dynamic support to economy, to private business, because private business is what really drives economies at once, and of course help people get income and really create jobs, which are extremely important.
Thank you, Mariam. A quick question with a quick answer from you, Mariam, from one of our audience members. It's about the Orthodox Church. Obviously, mosques and churches are big places where this can spread. And a participant is asking, they've heard that the Orthodox Church is continuing to hold mass and gatherings. What information, just quickly, do you have on that?
Well, what I would be able to share is that Georgian government is in very close communication and in tight partnership with Orthodox Church to ensure that the decisions are made for the sake of everyone's health. We've also seen examples of even the mass going, there is a social distance of 1 meter. However, since the new rule, since the thing that as of 3 days ago, we have national quarantine, I believe that there will be a very logical common sense in between the religious authorities and the government authorities, again, for the sake of people's health and lives.
Thank you, Mariam. Emre, I have a number of questions for you. One set of questions have to do with the refugee communities. Obviously, there's a lot of Syrian refugees, among other refugees. What information might you have about them? Also, Turkey, to some degree, controls part of northwest Syria. I mean, I know you're a biologist and this is not your job, but if you have any information about how Turkey is dealing with the refugees in the country or communities in northwest Syria where it is really the main foreign power. So that's one set of questions. Another set of questions, which you partly touched on, is the politics of this. The mayor of Istanbul is from a different party than the central government. Is politics, a problem? Is it becoming a problem for the people? How is it playing out? And the economy, Turkey is a G20 country, very proud of its economic role, but it looks like a very long economic crisis that Turkey is going into. Again, I know you're a biologist, but I'm getting these questions, so I'm shooting them to you.
So let me start with the comment that Ulana made. So I think that it was extremely important to emphasize the fact that China made a huge mistake to inform us about this pandemic. So you are right. So we can blame them about this. But if you would like to understand the crisis that we have been living in this big village globe together, we need to look at our own governments in the last 30 years where they invested the money. I'm a biologist. We knew that a coronavirus pandemic was coming. We knew that some other viral pandemics, bacterial infections will come in the future. So where do we invest our money? Look at the money, how much money you invested in science and in your health infrastructure in the last 30 years and compare it to what you spent for the military complex in your countries. This will answer the question why we are failing today to control this pandemic. So back to Turkey, refugees. Turkey have more than 4 million refugees from Syria, Afghanistan, Iraq. And as you know, there was a agreement between EU and Turkey. But because of the tensions in Idlib in the last 2 months, Turkey said, okay, refugees, you can go to Europe. We are just opening the boundaries. So hundred thousands of people went to western boundaries of Turkey, and they stayed between Greek and Turkish policemen in the boundary. So the Greek police was attacking with the tear gas, Turkish police was attacking. So these are poor people, and no one in Turkish media in the last 2 weeks have been talking about them. So we forgot them. I don't know what is going on. But of course, all diseases, all infectious diseases first affect the poor, wherever it is. That's why the Africa is the continent that is always affected the most and will affect it the most by this crisis, pandemic with the coronavirus. So refugees are poor people, and they will be definitely affected because they don't have a strong immune system, the first thing, and they don't have resources to protect themselves. In terms of Idlib, I have no idea, but what I believe is that Syria became a war zone thanks to Russia, US, European Union, Turkey, Iran, and all these countries. So I'm very sorry for the Syrian people that they are having the war of these other countries. And politics of Turkey. So after Gezi uprising in 2013, and after the military coup attempt organized by Fethullah Gülen movement that is based in Pennsylvania in 2016, the Turkish government became extremely oppressive. So it became an authoritarian regime. It was already a central government. So you are lucky in the US that you have a federal system which Californian governor can say, okay, we are locking down this city. But this is not the case in Turkey. So right now we have approximately 10,000 cases in Istanbul. It might be a new New York very soon, but the Ankara, so the Erdogan, and unfortunately it is so centralized that it is now one man who decides, because we know that the scientific council and the health minister know that it is the only way to control the disease, just locking down the disease, not the control, but just the slowing down the spread. But Erdogan doesn't agree, and the Ekrem İmamoğlu, who is the mayor of Istanbul, there are 60 million people living in Istanbul, and he cannot quarantine his city. So of course, the politics of Turkey, unfortunately, is affecting this. We are a very polarized country also, so it is very difficult to talk. So when you criticize the government because of what they do from a scientific point of view, people think that you are criticizing them just because of political needs. And lastly, you asked about economy. So people have to, but let's talk this within the context of the pandemic. Why they don't have this lockdown? Some people speculate that the Turkish economy cannot, will collapse if we lock down Istanbul, because Istanbul is the heart of the city. So they cannot risk this. So this is one idea. The second idea is that they decided to have a herd immunity approach that the UK started, but they just don't announce this. Herd immunity is a method that when the 60% of the population is infected, you will be protected from the infection. So I don't know, but we know that in the last 5-10 years, the Turkish economy in crisis. So they had a response to this. They did what many countries do. They have a fund to support the private businesses, and they made some reforms. But this is going on everywhere now. We have to support working class people. Working class people are the most vulnerable people. In the next probably 6 months, millions of people will lose their jobs. We will be in an economic crisis. I think we should think about what is our priority again. Where do we invest our money? Are we going to save Wall Street in the US? Or do we want to save the people who are losing jobs? This is same for all over the world. We have to now think about the people and not the private businesses or the benefits of the elites of this world.
Thank you, Emrah. Yulia, let me turn to you and maybe link the second round to the third round. We want to hear from you sort of the political and economic way this is being handled in Romania and Bulgaria. Them being members of the EU, that brings us into sort of the international aspect of it. How is that linked into the response in these two countries? And how do you see other regional or international players, whether it's the role of Russia? We've seen about, China. China maybe in the beginning was problematic, but also China's learned a lot of lessons. One might learn from them some things at this point. Tell us a bit about how these two countries are dealing with it politically and economically, and what's the international aspect?
In terms of the two countries, Romania, Bulgaria, and some of these aspects that they have in common can be generalized beyond the EU for the region, is that so the governments, as I've mentioned until now earlier, the governments have been doing a decent job at containing it as well as they could. But as Emrah pointed out, we were all unprepared. And the fact, and this brings me just briefly to the international aspect, the fact that we all knew publicly about this starting January 1st, and that our leaders across the West have in the region have failed to see this in time and have not taken the precautions, is clearly having a tragic impact on real numbers. And this is something that will affect Romania and Bulgaria in terms of economy massively. Moldova as well is a small country that is relying on foreign revenues, people who work abroad and who send money to their families at home. Romania and Bulgaria are less dependent, but still to a significant extent. So hundreds of thousands of people losing their jobs and their income will have a vast, abroad, will have a vast impact on the region itself. Of course, everything else, tourism, the lockdown in general in terms of services and of industry has already massive effects. And Romania and Bulgaria are so far some of the, if not the poorest countries within the EU. So clearly this links to a lot of problems that will hit these two countries within the European context particularly hard. Now, zooming into Europe a little bit, because we can't talk, as you said, Paul, we can't talk about Romania and Bulgaria without talking about the EU, is that the EU has been very, very slow in adapting to this crisis and finding solutions, and has been really gone under fire for many, many reasons. The first has been the lack of solidarity that we have seen among European countries, with an initial response that has been condemned by the EU Commission as being nationalist by France and Germany in not reacting quickly enough to the crisis in Italy. And so far, when we look now a couple of weeks later from the outstart, or the massive outstart, we have now a funding that is considerable. It's almost 40 billion euros that the EU has ensured for itself in aiding and in putting money together from different programs, unused money. So we clearly have the money, we're an economic power, but that doesn't yet show in terms of real numbers. Now the money will start to flow. For instance, Bulgaria will receive in this week, will have access to over 300 million euros for the crisis, and more will be released overall. For a country like Bulgaria size, it will be over 800 million plus access to the 40 billion fund. So that's huge help for all countries, but EU member states are still negotiating how that money should be spent and have not managed to find a consensus. And this has been also highly affecting the perception of the EU in terms of solidarity, with warnings from former heads of the Commission like Jacques Delors that this crisis could be sort of the cherry on top to affect the EU in its future as an entity. And another aspect that my co-panelists have mentioned in several contexts, and I want to bring to the forefront in this context, is disinformation that has been hitting hard everyone in the region and in the EU and in the West. It comes from both Russia and China initially, and it is spectacular how badly we've been prepared to respond to that. When you look at European titles, but also American titles in the newspapers, in the first few weeks, everyone really bought into it. And of course, medical aid is being helpful, but if 80% of it doesn't work, that doesn't make the news as much. And it's frightening because we also see our vulnerabilities at home, whether it's in the Black Sea or in the larger Western region. People have been unprepared to react to this. Governments have been very, very slow to react to this. There have been measures, for instance, Romania has taken very harsh measures in terms of disinformation that have been criticized by civil society as being undemocratic, because in the state of emergency, the government has given itself the right to block any website that spreads fake news. And so it's a huge debate now that we're having in Romania and all over the world, to what extent democratic governments, liberal democracies should intervene to stop disinformation in a slow reaction, but that could also affect our liberal democracies and how we understand them. And the response in terms of solidarity has been problematic all over the region, because many governments in the Black Sea have been blaming the EU for not doing enough. And frankly, the EU has been very, very slow to react in terms of regional cooperation, because that was the second part of your question. The EU has certainly been present, but has disappointed many EU partner countries in the region in terms of how slow they reacted and how little help they have provided so far. So the Eastern Partnership that brings in 5 countries from the region: Armenia, Azerbaijan, Georgia, Moldova, Ukraine, and Belarus, a little bit further from the Black Sea, has been putting out some money for the region, but clearly not enough. Has been redirecting 200 million added to 700 million for the entire region in aid. But even this money, the 700 plus some extra, is clearly not enough, and it's a last minute measure to help countries in the region. For the Western Balkans, for instance, it has been even less. But the reality is, when you look at these funds, it sounds like a lot, but they were initially directed, for instance, half of the 700 million that were directed to the Eastern Partnership 2 weeks ago, or before the crisis, so out of the context of Corona, France was lobbying that half of them should be invested in environmental issues in the region, which brings me to my very last point in terms of EU in the region, that we're seeing now with the coronavirus, something that has been clear both within the EU and outside for partner countries, that the EU has been problematic in creating a security dimension for the region, for Eastern Europe, both for members of the Union and for partner countries. And so funding is slow, aid is slow, and solidarity has been very, very reduced in the region, and this will have clearly an impact in the next few months as well.
Thank you, Julia. Thank you for covering kind of the second and third wave of questions. We are running low on time, so we'll try to urge you to be quick in this last round. And Ulana, I want to link a bit what Julia was talking about. Also, a number of attendees have asked about. One asked sort of a couple of general questions, which are very interesting. That this crisis might lead countries, obviously, to be, raise their borders, stop the flights, become more inward-looking, might encourage sort of nationalist, xenophobic trends. How do you see Ukraine and its neighbors and its environment in Europe? Do you see things going into less solidarity and less cooperation? On the other hand, a crisis requires cooperation, and we would like to hear about that as well. So how is it affecting sort of international relations as you see it? A similar question posed by the same person is internally in the country, that this, each country is dealing with this crisis in a certain way, government stepping up, civil society, citizens, cooperating more or less to some degree, government stepping in to help the economy. A number of people have compared this crisis to wartime and huge, crises like that. Or as Emre said, today it's a virus, tomorrow it could be a bacteria, it could be something else. Are the lessons that are being learned, and this applies to all of the countries, lessons that are necessary and useful for solidarity and strength of the country, things that would, become useful in the future? Is there any perspective on that? You've all already touched on sort of maybe what Russia is doing, what China is doing. You've mentioned a little bit, Ulana, about the war zones. An attendant has asked, do you see any new threats from terrorist groups or other sort of threats that, the government is busy with other things, or a lot of policemen are at home? Does that raise new threats? I know that's a bunch of questions. Don't answer them all, but pick one or two to respond to. We'll try to move quickly through this last round because we're low on time.
Ukraine is early in its Euro integration process. It's only began 6 years ago. And for Ukraine, the fact that Europe is internalizing a lot of its aid, because European countries need to help themselves at this point, and possibly the European Union countries, Ukraine has been forced to look elsewhere for that aid. And a lot of what Ukraine is doing, it's getting from China, and buying a lot of equipment that's necessary, and trying to ramp up internal production, especially of PPE, the personal protective equipment. When it comes to how internally things are going, Ukraine is in the middle of a war. So the people are already ramped up for that sort of a response. And very similarly to the beginning of the war, when President Yanukovych fled the country and pretty much bankrupted it by taking all of the money out of the country's bank accounts, there was a question about how much money had we spent on our military-industrial complex. Actually, none. And that was one of the problems why Russia was able to invade and occupy much of our part of our territory, because we didn't have a successful military at that time. So what happened was the people of Ukraine pretty much had to step up, civil society, local governments, businesses, and help the military build up. And only after a couple of years was the country back on an economic track where it could start investing in its military. Medicine is something that Ukraine has not been investing in for a very long time. And so only in the last 3 years, we've started going through a healthcare transformation where we're cutting out a lot of corruption and putting that money where it should be in treating patients and public health. There had been no public health program and no public health service in Ukraine until 3 years ago. So we're, again, early in that, and this is a big blow to that. But it will bring the attention back to the medical system, of course. And similarly to the beginning of the war, the Ukrainian people, civil society, business has stepped up. And they're the ones that are supplying much of the equipment and much of the PPE, buying it wherever they can. The government is buying it where it can, but economically there isn't as much money. So it's been a unifying effort, again, with the people of Ukraine, and they're much better at it than they were in the past. There's much less infighting and a lot more coordination that's happening. So I think that for Ukraine, we're actually moving forward in we're consolidating as a country. And also we're not closing down, but we see that it's difficult to engage with those countries that are currently so internally, the attention is inside their own countries and dealing with their own problems.
Thank you so much, Ulana. Mariam, I'd like to hear your thoughts, and particularly any information about how Georgia, its international relations, who's being helpful, who are you being helpful to, how has the outside world helped or hindered your efforts? Hold on. There you go. You were muted. I've unmuted you. Go ahead, Mariam.
Okay, thank you. Thank you very much. Well, I think in these times, it's extremely important that we all stand right next to each other, support, do an exchange of past experiences. And in the end of the day, it's not only about the money. I think what the example of what we've been hearing about Ukraine is extremely important, because we as Georgians, we affiliate to what Ukrainians are going through and have gone through, because our key pain and the biggest problem nationally is the occupied territories. And we have South Ossetia and we have Abkhazia. And now with the fight of COVID-19, a Georgian government with all its network is trying to be fully in touch with everyone who is on the side of the occupied territory. And we see that people are crossing this occupied border to get treatments from our side of medical team. And this is something that is very important, because we will always continue to share and to ensure that we create facilities for those who are still part of us and used to be, one whole. So in general, what we for now can share is that United States, who has always stand right next to Georgian government, is providing 1.1 million in the health funding to Georgia to help prepare laboratory systems, activate case findings, event-based surveillance, support technical experts, and much more. As for European Commission, they've announced an extraordinary solidarity package of reverse assistance to Georgia to help us handle the challenge of COVID-19. Package response to both to the immediate needs and the health systems as well. We have EU mobilizing over 70 million euro to help Georgian business get easier and more affordable access to Georgian lari-based credits and grants to boost and rebuild companies. This is in addition to another 20 million euros on the local targeted grants they plan to launch in upcoming months around the country. Of course, our expectations were slightly higher. However, we're extremely grateful to all our international communities, donors who have showcased their willingness to support Georgia within the fight of COVID-19.
Thank you, Mariam. Thank you very much. We're almost out of time, so I'm going to turn to you, Imra, for the last question, and a different question asked by a number of our attendees, and it relates to more the scientific end of things. One is, how do you see the WHO has been handling this in terms of expertise and information? maybe not going back to, the very early days, but are they now up to speed? Are they now sort of providing the right guidance and assistance? And the second question asked by one of the attendees, as somebody following this pandemic, have we learned anything significant from South Korea or for some of the scientific research that tells us, I mean, the path that we seem to be on, people say, is 1 year to 2 years of repeated closures and slowdowns until we can get a vaccine.
Yes.
That's a long time for societies and for economies. Do you see other pathways?
So, first of all, right now, Chinese medical doctors, Italian medical doctors, French, and now the ones in the US are doing several clinical studies to understand if we can find any drug that can work to help these people in the intensive care units. And there are some good reports. Of course, we need to do very large clinical studies to understand, but if we can find this drug, it will really reduce the mortality rate. So this is good. In terms of vaccines, I'm trained as a vaccinologist. It will take time. And we are not sure if these vaccines will work or not, because most of the people that this virus affects are over 60 years old. And there's a fact called immunosenescence, which as you become an older individual, your immune system will not be as strong as it was. So you will not get a good immune response by the vaccine. So there's also this question mark. But hopefully we will be able to find some drugs in this stage to be able to at least lower the mortality rates. In terms of the finding people who are infected, so Ulana just gave an example from the Germany. If we can if there's a microbe that infects you, your body is going to produce some antibodies against this microbe. And if you have these antibodies and if you're a healthy individual, it means that you are infected and you probably have a strong immunity against this virus, so you can go to work. So this is a good model to be able to take these people who are infected and they can go back to work, but we are still not sure if we will have infectivity or if this virus will have some mutations that will cause vaccine not to work, and we also don't know how many years this immunization will continue. Before finishing, I would also like to show one more thing about Turkey. So do you see my screen right now? So in Turkey, we had
Yes, we see it.
also this problem. So a medical doctor in Ankara University, so here you see the picture of her, Dr. Güle Çınar. She was giving an internal seminar to the people working with her in the hospital. She was talking about how serious this disease is, because that time the official rate was hundreds of cases. She said there are thousands of cases, it is everywhere. And then here you see a tweet from Ankara University, it is still there. And then they asked her to apologize and started an investigation. This is Dr. Yusuf Savran from another very big university in Turkey, from 9 Eylül University from my city, Izmir. So he made a video and told people that the things are going bad. It might be as serious as Italy. And then again, they asked him to apologize from the government officials. So he needed to make another video, and then he apologized. Also, this shows the operation of the medical personnel. And here you see a truck driver. So he made a TikTok video and he said, hey, look, I'm a working class man. I have to work, I have to pay my bills. And then this video became viral because millions of people are complaining every day that they have to go to work. And then they arrested this person the same day. And then the next day he was free. And the other thing that I would like to emphasize is here, we have to protect our medical professionals. So yesterday we lost Professor Jimmy Taşçıoğlu. You see his picture here. He was a professor at Istanbul University. And this is a nurse that we just lost. She was a 33-year-old woman. As of yesterday, we have 601 health professionals that are infected in Turkey. This is very high, and this will probably be higher. The Turkish Medical Association has been crying to ask for more PPEs, and it shows that within 2-3 weeks, we have 601 health professionals. So TMA, the Turkish Medical Association, wants to be a part of this process of the pandemic control, but the Turkish government doesn't let. And the last thing that I would like to emphasize for all our colleagues here and anyone that are listening to us. So this report is from New York. New York is the most infected city in the US and right now in the world. So in the US, there are 3.57 people, and this is much higher right now. This is the data from 3 days ago, of 1,000 people are infected. But in the Rikers prison in New York City, it is 27.85 people for 1,000 people. So the social distancing, hygiene are the main tools that we have to control the spread of this virus. And this is the people in the prison do not have social distancing or hygiene. So in Turkey, we have prisons that are overcrowded. They became even more crowded in the last 5 years. We have many journalists, many lawyers, many politicians, especially from the Kurdish opposition. And many of these people are under risk. If you are over 60, or if you have any chronic disease, including hypertension, diabetes, any lung or kidney disease, you will probably get if you are infected, you have a very high risk to die. So all these countries that we are talking about, and especially the US, which has 2.5 million approximately people in the prisons, we have to protect these people. So this is my last note about in this panel.
Thank you. Thank you, Emrah. I want to thank, we've come to the end of our time. Obviously, I want to thank all of our panelists, Ulana Suprun, Mariam Krivishvili, Emrah Al-Kindish, and Yulia Sabina Joja. I want to thank the MEI events team for putting on this webinar. This was the first event of our Frontier Europe program. This was focused on the Black Sea region. We will have similar events on the Caspian Sea region and other events. So please stay tuned. I want to thank all of the attendees who joined us online. And I tried to get to as many of your questions as I could. I couldn't get to all of them, but we will relay the questions that were not answered by email to our panelists. If you have any other questions, just email them to events@mei.edu. It's a grim situation, but hopefully there will be hope over time. Good luck, everybody. Stay safe, stay well, and we hope to see you at another event. Thank you.
Thank you.
Thank you. Thank you very much, Paul.
Bye-bye. Thank you.